Okay, we still have some people trickling in, but we'll go ahead and get started. So hello all, my name is Mimi Mudd, and I want to welcome you to the 2024 Spring Family Webinar Series. Tonight, I am joined by my colleague, Carolyn Herman, the Associate Dean and Director of Pre-Health Advising. We are excited that you've chosen to join us for tonight's conversation about pre-health advising, and I just have some information before we get started. So first, we want to make sure you know how to submit questions during this webinar. You'll notice that we have given you the ability to ask questions through the Q&A feature in Zoom. Our staff within Student Transitions and Family Programs will be helping to field these questions throughout the webinar. So to make sure you know how to use the Q&A feature, we're going to ask you to share the student's year in school. So what year in school is your student? Go ahead and plug that into the Q&A feature now as a test. And then that will also help us kind of give Carolyn an idea of the class years that are represented and the attendees tonight. Secondly, please keep an eye on the chat feature where we'll be sharing links and email addresses throughout the duration of the webinar. And then finally, this webinar is being recorded live. So next week, it'll be uploaded to our families.wustl.edu website for you to check out. In a moment, we'll be hearing from our panelists about pre-health advising. If something she says sparks a question, don't forget to send us those questions in the Q&A feature. And I will go ahead and share. We have students who are first years and then also sophomores. Seems to be kind of the predominant student population, but we do have a little bit of a mix in attendance tonight. So now, since I know you all want to hear more about pre-health advising, I'll go ahead and turn it over to Carolyn to introduce herself before we begin our Q&A.
Hi there. I'm Carolyn Herman, and I'm just delighted to be able to spend some time with parents and families tonight who have children probably here at WashU who are at least considering a pre-health path. So I direct pre-health advising. I have a terrific team that works with me on this, and we do provide advising for all health professions. That said, pre-med is our largest population. I'm just going to go ahead and share my screen here. And there we have it. So I want to start tonight on our pre-health website. You'll see that the address here is just prehealth.wustl.edu. And you can see also that there are a number of, great links here. If your student is not sure, they're interested in healthcare, but they're not sure specifically what field, there's some advice for them here. If they know what they want to do, then this planning your path tab is a great one. And there's also great information for parents and families on here as well. I thought we would maybe just quickly look at this timeline, and I'm going to encourage you to encourage your student, if they don't already have an account at the My Pre-Health portal, to go ahead and sign up there. It's a WustL Key linked thing, so they just go to myprehealth.wustl.edu, and the first time they go there, they'll be prompted to create an account. I'll toggle over there now to show you what the student view of this this tool is. So for first years and second years, the parts of this that are going to be relevant are going to be the announcements section. So every Wednesday, we send out an announcement with information about opportunities, some, just kind of encouragement. And so I love to, see people get in the habit of opening that on Wednesday and at least skimming it to see if there's something relevant for them there. They also can start using this activities section. They can enter activities. And this is a test student, so there's been some, some kind of entertaining things entered there. But so students can enter activities, but inside a specific activity, there's also a place for them to kind of do some journaling and some reflection on that activity. They don't have to do that, you know, in this tool right now. If they would prefer to use, you know, some their notes function on their phone, you know, a little moleskin notepad, whatever works for them, that's great. But some thoughtful reflection, even early on, about activities that are related to testing and confirming their interest in a health career is going to be super helpful to them down the road. Now, you can't get into this because this is behind their WustL key, although I just show it to you so you can, you know, encourage them to take advantage of that. But you all have access to the website, and there is a terrific amount of information here. So the next step on this timeline is that at the end of the first year of college, we invite all pre-health students, so all students we think might be interested, to participate in a non-credit Canvas course. So there's a link here where they can enroll in that. And after they finish that non-credit Canvas course, which is not a huge burden, students spend on average about 5 hours in the course. So, you know, it asks them to do a little bit of reflection, hopefully teaches them some baseline information so that when they actually meet with their advisor, they can have, you know, higher level conversations and ask better questions and make better use or make really good use of their time with their advisor. So students could be assigned an advisor if they do that course right away. They could be assigned an advisor as soon as, you know, summer after their first year in college, but it is fine if they're not ready for that yet and they want, you know, to take more time and decide if this is really for them. You know, they're just not invested in this yet. That is absolutely okay. They might do this, you know, exploration course when they're a junior, and that could be fine. But whenever they finish that, we'll get them an advisor assigned. I will say that most of my students are taking at least one gap year. 80% of my students intend to take a gap year, and I find that the students who are trying to go straight through sometimes are just a little less successful overall than the students who are applying at the end of their senior year and will be working in, you know, at a job while they're interviewing for medical school. So we in no way discourage gap time. You know, if it will only improve the student's application. Another thing that I think is terrific that we do here at WashU is we really have a very structured process in the year before they apply, most of that, you know, really that entire academic year, to help them prepare their application and to help them, you know, really put their best foot forward in the application. So there's that. It also invites them into another non-credit Canvas course, which is a place where they can communicate with their advisor. They also communicate with their advisor through the My Pre-Health portal. And then, very important, you must apply to medical school in June. And we see, and you know, independent of MCAT scores or GPA or anything else that we can easily measure that we think might affect success, you know, holding all those factors constant, the later you apply, the less likely you are to be admitted. And that's like a pretty consistent average of about 3.5% less successful, or a lower acceptance rate per week after an initial like time period after about the 3rd week in June. So if students are not really ready to apply in June, we really encourage them to just wait to the next cycle, and that's okay, you know. And there's no law that says you have to go right away. I have students who take multiple years out. We work with students who go and serve in the Peace Corps and then come back and, you know, decide that they're applying to medical school. So the WashU students are always ours. We're very happy to work with alums, and, you know, students should determine for themselves what their optimal timeline is. We don't push that. And we work with people when they feel like they are ready. So I think that is kind of an overview, and I would love to take some questions.
Great. Thank you so much, Carolyn, for that information and for being here tonight to answer those questions. I have a question to kick us off, and then just a reminder to parents and families to be plugging in those questions in the Q&A feature. So first question for you, Carolyn, is what would you recommend for, or like, what's your advice for students to stand out in their medical school application?
Great question. So I think that medical schools are looking for students who are really understand what they're getting themselves into. So they've got abundant clinical experience. They have had some opportunity to observe physicians, so they can, articulate why physician is the right role on the healthcare team for them to play. They also have enough patient-facing experience. They have their own experiences interacting with patients so that they can, compellingly and clearly convey that they know what it's like to work with people who are ill or injured, maybe not at their best, and that they really enjoy that. They find that energizing, that they've been in the hospital setting, which is where they're going to train, and that they find that, an exciting place to be, not a, stressful place to be or a depressing place to be. So I think, enough clinical experience that students really know what they're getting themselves into. So it isn't really necessarily about a specific number of hours. It is about the learning that you can demonstrate. So it's not about seat time. It's about what you've learned from your experiences and how well you can convey what you've learned. But we do see that of successful applicants, the 25th percentile for the number of hours that they are reporting of clinical experience is about 300. So yes, a fourth of our successful applicants have less than 300 hours, but 3/4 of them have 300 or more. So I think that's just an important, kind of marker for students and families to, be aware of. And that is perhaps one factor that is also driving many students to plan for a gap year, because since you apply in June, you really can't use anything that you do the summer after your junior year. Your application has already been submitted. So just summer after first year and summer after sophomore year, are you going to get 300 hours in that are high quality, that you learn enough from, that you have this compelling narrative when you go to apply at the end of your junior year? Maybe. And a few students do accomplish that, and that's great. But if that is not happening, it doesn't mean that the student is, in any way less effective. It means they're like 80% of their WashU peers who are taking at least one gap year. So that's one thing I would say, is that they've got to have really enough clinical experience to have that compelling why medicine that is authentic. The second thing that I think medical schools are looking for is a commitment to service. Medicine is a service profession. It's a well compensated one, but it's still a service profession. So they are looking for a real commitment to the welfare of others. And so I think students are advantaged in the process who have longevity and increasing depth of commitment in something that is primarily to the benefit of other people, not primarily for their own benefit. And there's so many ways. So like, there isn't any magic recipe about how to stand out, right? You stand out by being yourself and being somebody who really knows that they want to be a doctor and why, and being somebody that really cares about the welfare of other people and has demonstrated that with how they spend their time. It's not just something they say.
Thank you for that. So that has sparked some follow-up questions. So I'll start with the first one that goes back to kind of your introduction. When you were speaking about the Canvas courses, can you clarify whether those are virtual or in-person courses?
It is all asynchronous, you just do it online. And that's why summer after first year is, the first good time for students to do this. We don't want to distract them from their academic work during their first year of school. And they really don't need an individually assigned pre-health advisor before that anyway. No one needs that. We have drop-in advising 4 days a week, and I will just pivot back over. Oh, I think I might have turned my screen sharing off. Well, there is an advising tab on the pre-health website that lists, where to go, the Zoom link, or you can come in person to couples. And so you can either come in person or hop on Zoom to talk to an advisor. And that is great for first year students or second year students or juniors or anybody who is, has questions about pre-health, but is not sure enough to have committed to finishing our exploration course.
Great, thank you. Okay, then we got some follow-up questions specific to you mentioning like clinical hours, shadowing experience, etc. So how should students go about obtaining these clinical hours and shadowing experiences?
So I suggest that students start when they are home. That might be in the summer after their first year. It could be while they're home over a break, a longer break like winter break maybe. But I suggest that students start at home. They should contact their pediatrician. Maybe their pediatrician will be very excited that, they're that a young person that they treated, over the years kind of wants to follow in their footsteps. I encourage them to, if the pediatrician is not open to that, or if they just want to shadow more than one kind of specialty, they don't think they're necessarily especially interested in pediatrics, their parents, physicians could be a good resource. Anyone in their network that works in healthcare, friends, parents, friends, people through community or religious organizations, anybody in healthcare is a potential connection to some type of shadowing or volunteer healthcare experience. And so I think starting at home where you have social capital is the perfect place to start. I guess I will add to that older students, and I really don't recommend this before summer after junior year, truthfully. Although a few students do it earlier, and if that's right for them and they're thriving, that's great. That's, they should, you do you. There's not a right way to do anything, but I don't necessarily push this before summer after junior year. But some students get a part-time job as a patient care tech, as a transporter over at Barnes, something like that. And they work maybe even full-time over the summer and then part-time during their senior year. And that can be a terrific opportunity as well.
And then what does pre-health advising or WashU offer in helping connect students to clinical and shadowing experiences? Are there opportunities through WashU?
The really only opportunities that are WashU sort of specific are our PEMREP programs. So students can take a course where they assist with clinical research in the Children's Hospital emergency room. Now, obviously, that is a course that only has so many seats, and you have to be at least a sophomore before you can even take it. But it may fill up with seniors and juniors. In truth, we also have our med prep program where students can shadow in the emergency room at our adult teaching hospital, Barnes. And that is about 60 students a semester. It is also offered in the summer. So if students want to stay here in the summer, if they're doing research, and their PI doesn't object, they might be able to do that in the summer as well. So we do have 2 courses that get students into our teaching hospitals, but I think those are not going to be robust enough for those to be a student's only clinical experience. Now, we also have lots and lots of student groups that have organized various kinds of volunteer activities. So there's a group that goes over to Children's Hospital and, is connected with the, a couple of the floors over there. And they take like science activities to the bedside of children who are going to be, medium to long-term hospitalizations. And that's a terrific program. Students can also apply directly through the volunteer offices at all of the local hospitals. And they, can work in possibly the child life unit in the playroom at Children's, or they can work in, on a floor at St. Mary's, which is, also just a quick bus ride away. You could actually walk there. I have done it before. So, but it's faster to take the bus for sure. So 2 stops on the train over to our teaching hospitals and a quick bus ride on the number 2 red line to get over to St. Mary's. And so lots of my students do volunteer at the local hospitals.
Great, thank you. And then when it comes to summer breaks, are there specific things you recommend for a student who is currently a first year to do over their summer break?
So a few students, especially if they have prior experience with research and they were really excited about it, might stay here for the summer and join a lab, and that would be fine if that's really what they want to do, but no one should feel any pressure to do that. It is absolutely fine to go back home. And I know, when my children were first year students, I wanted them to come home and they were kind of ready to come home. And there's nothing wrong with that. They can pursue either volunteering at a local hospital at home or shadowing opportunities in, that they develop in their local network. They can pursue service projects with nonprofit organizations around causes that they care about. And that is a terrific pre-health summer. And it's not a bad thing either for them to, if they have if they've had a job as a camp counselor and now that they're in college, they get to go back and be kind of like a senior counselor or something, that's fine too. Like the first summer does not have to be all about your med school application. There's time.
Awesome. And then same question for a sophomore student.
I think by sophomore year, I would love to see students doing something that is either clinical or service at least some of the time. So that might be if they're in a research lab, and lots of sophomores are. They don't have to be. And if research is not your kid's thing, they're not missing anything. Research is not required for medical school. We have a lot of research opportunities here. That's kind of like, one of our flagship things. And so if students want to take advantage of that, I encourage it, but it is not required. But lots of students do research summer after their sophomore year, but they can also maybe volunteer at the hospital, in the evening or on the weekends when they're not in the lab, or they can, do something again, that's either service oriented or clinical, at least part-time in sophomore summer.
Great, thank you. Okay, so moving back now to more general about pre-health advising, can you highlight for us some of the key resources you want people to remember and take away from this webinar when it comes to pre-health advising? Some of the key resources you all provide.
I think the pre-health website for sure. And under the pre-health website, there is actually a resources tab. And maybe my behind the scenes person will find that in a second and drop that into the chat even. And one of the very first cards on that resource tab is actually a parent guide. So I invite you to take a look at that. And one of the things we really emphasize in I think our most important resource is that we really believe that everybody who wants this, every WashU student who wants this, it's theirs. It might not be on the timeline they wanted, it might happen on a different path than they expected when they left high school, but there is no academic mistake that they can make that will close the door to medical school. So if your student is not experiencing as much success in a particular class, that is okay. They just need to build the skills. By the time they apply to medical school, they need to demonstrate their readiness for a really rigorous, biomedically oriented graduate program. But if medical schools wanted you to be able to demonstrate that on day one, they wouldn't make you go to college. So it is okay, whatever their path is, to develop the skills and tools they're going to need to succeed at the next level. They should do that. So also really encourage parents to be supportive of, it's okay to do this your way and find out what's really going to work for you, and you will get there.
And then we did have a student ask specifically, or a parent family member, about PA school specific pre-health advising. Can you speak a little bit to that?
Yes, we actually have an exploration and application Canvas course for PA, and we would invite anyone to join that. You don't have to even have a pre-health advisor to jump in on that, and students can find that in if they create an account in the pre-health portal. All of the Canvas courses and their links for self-enrollment are in there. So I would encourage that. If students are pretty sure about PA, we're happy to get them assigned to our PA specialist as early as they would like to do that.
Great, thank you. Okay, kind of on that train, when it comes to being assigned to a pre-health advisor, when and how does that occur?
So that is it could be as soon as the summer after first year, or anytime after that, after they've finished our self-exploration and self-reflection Canvas course. It's called a reflective guide for pre-health students. And it really just asks them to do a little bit of research about what is healthcare, what kinds of skills and capacities do you need for that, a little bit of self-assessment, which of those am I already strong on? If there are ones I'm not as strong on, what are my initial ideas for how I would grow those?
And do they have to be declared pre-med students as well?
There's no way to declare pre-med because it's not a major, or, it's just a basket of classes you do. And, then some interaction with your advisor to prepare to apply. So no, you don't have to declare. You just have to do our reflective guide and tell us you're interested in medicine.
Great. And then if someone wanted to know what those classes and courses students should take that are prereqs, who should they talk to?
You can go to the website, and under the planning your path, there's lots of information about courses, or they can come to, I don't like to read the directions either. I get that. When I get a new phone, I just click around, and if I can't do something, hopefully I got it for Christmas and my kids are home and they show me. So if they just want to come to, to drop in advising and ask somebody, that's okay too.
And then when do pre-health advisors first reach out to their assigned advisees? When can students expect that contact?
I think that most of my team will not necessarily reach out to, as soon as an advisee is assigned. I think that we let students sort of take the lead in how often they want to meet, and what their needs are. Certainly early on, students who've been recently assigned advisors, we're not trying to pester them and create additional, even a perception that that there's pressure to do anything in particular. It really can be the way they want to create their own path. If it looks like, if I have a senior, really, even if I have a junior that I have not seen by the middle of the year, I'll probably reach out and just say, like, hey, do you have any questions? I'd love to meet you and start getting to know you. But we let students take the lead first so that it, fits into their schedule, is comfortable for them.
Great, thank you. Okay, kind of moving back into applying to medical school. We had some questions about the typical acceptance rate into medical school for WashU students, if you happen to have those numbers on the top of your
I I do. For our first time applicants that work with us so that we advise, and the data we publish online includes students that we don't advise necessarily. I think maybe, I'm not sure exactly what's published right this second. We're making some changes to that. So I'm not sure what's right there right this second. But students that we advise, that we work with, about 8 in 10, about 80% of my first time applicants will be admitted, which is great. I mean, that's a very high acceptance rate. That also means that 2 in 10 do not. And, there's a couple of reasons for that. The first is that we don't keep anybody from applying. It's your decision when to apply. And if we've told you that you're maybe missing something and, you've got sort of a little bit higher risk in this process, and you're like, yeah, I still want to try, then we do everything we can to help you put your best foot forward, but it might or might not work out. And you will learn from that experience and you can reapply. So reapplying is very normal. There's nothing wrong with it. And about 20% of my students will. And then they get in. So that's the other thing, is that, I feel like students feel like this is, oh, such a competitive, high stakes thing. I really like to think of this as, it's more like looking for a job. It's just a job you can only apply for like once a year. And it is actually applying for a job. It's just a job with a really long on the job training program, right? You go to medical school and then you train for the job of being a physician for a really long time. And then you finally start getting paid for it instead of paying them for training. But you wouldn't, if your student was applying for summer jobs and they didn't get the first job they applied for, you wouldn't think, oh, well, maybe they're just not really a worker. Maybe they're just not cut out for this working thing. You would tell them to keep applying. And really, that is the same message is appropriate certainly for WashU students in this process as well. All of them can do it. And if it's right for them, if they really want it, all of them that really want it will do it.
Okay. This next question, I'm going to try my best to ask because it has some specific terminology I'm less familiar with. So, when a student is constructing their school list and looking at, I guess, really any type of school, but they specified out-of-state public schools.
Okay.
What should they be looking for in relation to matriculation rate and MSAR?
So that is, yes, that sounds like a question from a parent who's been close to somebody who's already gone through this process or is going through it now. So yes, the American Association of Medical Colleges, which accredits all the medical schools and sponsors the medical school application process, publishes kind of an online catalog of all the medical schools. And that's the MSAR, medical school admissions requirements. It does indeed list admissions requirements. So, what courses do you have to take or things like that. But it also provides a lot of data about the previous year's class. So you can see, for example, if you look up the University of Illinois, that they actually took maybe a third or more of their students from out of state. So they are not leaning as heavily on state residency as a selection factor. If you look up the University of Arkansas, you will see that they have maybe like 2 or 3 people from out of state. And they, residency figures very, very strongly in their selection process. So different state schools do have different attitudes on this. I suggest to students that, if they're admitting less than about a third of their class from out of state and you're not a resident of that state, you're putting a lot of time and energy to competing with a lot of people for a very small number of seats. So unless that school is really perfect for you for some reason, and that could be fine if it is, you know, you might want to look elsewhere.
Thank you. Okay, now moving on to pre-writing secondaries, another terminology I'm less familiar with. So this is their question. What recommendations do you have on approaching pre-writing secondaries?
This is lovely. So I think it's a great idea if students have the time and energy. I think, you know, they need to get their primary application really polished first. So medical school is similar to the college application process in a few ways. It's very different in some ways, very different in some ways, but it's similar in a few ways. And one of the ways in which it's similar is that there is a common application, AMCAS, or if you're a Texas resident, the Texas Medical and Dental School Application Service. So there's a common app. So all the medical schools get the same personal statement, the same transcript, the same list of activities, and your reflections on those activities. And then the medical schools send out a supplemental application, just like many colleges do, and certainly like we did, I think, at least. I'm not sure if we're still doing that or not, actually, but when my kid applied, they did. So there'll be additional essays, and just like the college process, some medical schools have long, you know, multiple essays. They're 5 or 6 questions you have to write, and long character limits for how long you know, how much you can send back to them. And other schools will have 1 or 2 questions, and one of them will be like, what do you know about our school and why do you like it? You know, it won't be like anything particularly you know, tough to figure out an answer to. So that varies enormously. We do really encourage students to make those secondaries very specific, but again, to the school they're applying to, again, you need to have a really polished Common App before you're going to start like diving into individual schools' supplemental applications. So for most students, that's going to happen, you know, pretty much after they submit in many cases, but they might, you know, they might be ready in May, or, you know, they also don't want to derail their studying for finals for the last semester that's going to be on their transcript with a bunch of pre-writing of secondaries. So, you know, all of this is, you know, some common sense about how to, you know, manage your time and energy. But in May, after school is over, and when they feel really confident about their application, they might start looking at various schools' secondary essays. And I think that can tell students a lot about whether the school is actually a good fit for them. If the school is asking questions that they think, I don't know if I even have a great answer to that, maybe that's a sign that that school is not really a terrific fit for you. So I think it is absolutely worth at least pre-reading secondaries. And, you know, whether you sit down and write them then, or, you know, whether you just have that sort of, you know, percolating in the back of your head, I think that's really, really a smart call.
And then a follow-up question, I'm assuming is coming from someone who's like already applied, is in your experience, do the secondaries stay the same from year to year, or should students anticipate that some of the secondaries may change?
Oh, they could change for sure. You know, you get a new dean of admissions and they want to, you know, they get their team together and, you know, have a reorganization of everything. Like that can certainly happen. That said, most medical schools are not trying to reinvent the wheel all the time. And so many secondaries do stay stable from year to year.
Thank you. And then I know you said that you recommend that students make them specific. Is there a way, like, what's your recommendation on students kind of creating a few different secondaries on different themes like adversity, diversity, leadership, etc., and then adjusting them to specific schools? Or do you find
I think that's great. Yeah, I think that that is a good approach. And I think, you know, that will work for most students. I think, you know, my shorthand for this when I talk with the students I'm advising is, you know, you don't want what you send out, you don't want to send a form letter to 20 schools. You want to send 20 love letters. But like love letters, they could have a lot of content in common, right?
Perfect. Good example. Okay. So, how does a student's chosen major impact or benefit their application and or success in application?
So there is no major that helps, there is no major that hurts. The major that is going to help is the major that you love. And because they are looking for students who are intellectually curious. And so if they ask you about what you're studying and you're kind of lukewarm about it and you don't have a lot of genuine enthusiasm for the courses you've taken, that will not be helpful in the interview. That is for sure.
Thank you. Okay. Moving a little bit back to getting those like clinical hours. Are there any programs or online certifications you're aware of that you would recommend students to take in order to be more likely to get those clinical hours? And they gave the specific example of a medical scribe.
Yeah, so that a little bit depends on where they are going to work or volunteer. State regulations. So all healthcare licensing is state specific. So your physician is licensed by your state, not by some kind of they are nationally board certified, but they are licensed by the state. So here in Missouri, which should surprise no one who's looked at our local politics, there's not a lot of regulation. And so physicians who are in private practice or the local urgent cares or the local hospitals are free to make their own decisions about whether they want to require people to have a certification before they're hired or whether they're going to do on the job training. So lots of my students find positions here in St. Louis where they can do on the job training. That actually is a thing here. I think there are other states where that is absolutely not legal. Like physicians aren't allowed to hire people who are not a certified medical assistant or, have some equivalent kind of qualification. So students have to do a little bit of research about what's really going to be required in the area where they want to work or volunteer.
Great. Okay. And then we had someone ask, just to clarify, if you can reconfirm that pre-health advising is available to alums, not just current undergraduate students.
Absolutely. They're always ours.
Right.
And even before the pandemic, we were set up to work with people remotely because it was so important to us that students would feel like they could set their own timeline and apply when it was the right time for them, and that we weren't, somehow pushing them to hurry up because something about how they would connect with our resources would not be as effective. So, I had Skype before we had Zoom. Remember Skype? I had Skype and I would Skype with students. The writing center had virtual appointments to work with students on their personal statement. The career center held virtual mock interviews before we even had a pandemic, and we're all doing things on Zoom. So we've got lots of practice with that. We're well set up for it. And we just welcome students to really choose the timeline that is right for them.
Great. Thank you. Okay. And then we had another pre-submitted question that I feel like we've touched upon, but just in case there are other things that you wanted to add about the curriculum and opportunities at WashU for pre-health students.
So I think, the curriculum is just a basket of classes. There are certain classes you have to take. I encourage students to check their state schools and their dream schools' actual requirements now. Put a spreadsheet together. You might learn that you actually do not need any calculus. There are very few med schools that are requiring calculus, and Calc 1 is fine almost everywhere. Like you don't need Calc 2 even to be pre-med. So, you might learn also that statistics is actually a required course for you at your state school. And you better figure out like where you're going to work that in, because you have to take that before you graduate. So I think it's great to start a spreadsheet, as early as you're sure about, your long-term goal. start looking at least your state school's requirements. Beyond that, I think in terms of opportunities, there's a ton of research going on across the park there at our School of Medicine. And from basic science to clinical research teams, lots and lots of my students get involved in that research. They have terrific experiences. They learn a lot. They, develop wonderful relationships with mentors who are, scientists and physicians. And so I absolutely encourage that. That said, if you know research is not your thing, it is not required and you don't have to do it. If you've already tried it in high school and you hated it, that's okay. Although I would say try clinical research. That could be really different.
Thank you. Okay, now we got a few questions about interview prep and mock interviews. So what resources are available at WashU for interview prep?
The Career Center is our, command central for all interview prep. They hold workshops that are, some more kind of group practice. They also do individual mock interviews. They are set up to help students prepare either for traditional interviews or MMI, which are kind of more like performance-based, assessments. So yeah, go to the Career Center's homepage and schedule a mock interview.
And then is there a certain number of mock interviews you all recommend students have before they kind of go into the actual interview phase?
I mean, I think that very much depends on what kind of feedback they get from their first mock interview. And this will come as no surprise that, different people are, have different strengths. Really extroverted people that already have done a lot of practice at interviewing for lots of different things sometimes don't need that much help getting ready. Students who describe themselves as shyer, who are not as confident with the idea of interviewing, may need to practice more.
Great, thank you. Okay, then are people able, and maybe this is dependent on school, are people able to pick up medical school requirements in community college, like maybe over summers or?
Yeah, no, I think basic requirements at community colleges are fine. I really think most med schools don't care. Especially if you don't live particularly close to your state school, or, to whatever your flagship sort of state school is, or if if it would be a financial burden for you to, pay for the credits at your state school and they're a third the price or a quarter of the price at your local community college, and that's an important factor for your family, I think that is fine. And medical schools are going to understand that.
Great, thank you. Okay, and then we have a question about the array of experiences that your team, pre-health advisors, have.
Let's see. So on my team, we have a PhD in environmental biology. My background is in biochemistry and chemistry education. We have a very experienced advisor who is, I'm actually not sure exactly what her degree is in, but she's been on this team for like 10 years and is just terrific. We have relationships with a couple of advisors in the departments. So we've got a couple of PhDs in the biology department who do advising, and we have a PhD in the chemistry department who does advising. We have a physician who is part-time at the Career Center who is on my advising team. We also have a physical therapist who's a part-time advisor at the Career Center on my team. We've got a really great relationship with a faculty member from the occupational therapy program who advises all the students who are interested in OT. We have a faculty member in biology who actually started his career when WashU had a dental school many years ago, and at the dental school. And so he does the pre-dental advising. Let's see. I guess that's, oh, and we also have somebody on my team who has a PhD in philosophy, but when he was in college, he applied both to medical school and to graduate school, got into both, and decided he wanted to go to graduate school in philosophy instead of medical school. So we have somebody on the team who's actually applied to medical school and successfully many years ago. He was like, it's really changed. It's changed a lot.
Awesome. Sounds like a good variety. I love that. Okay, now we have a question kind of more financially related. So are there systems in place to support students who may not have the financial capability to apply to medical school and or take those entrance exams?
So our Student Success Fund is set up for things that cannot be included in the financial aid award, that the federal government will not allow to be considered as part of the cost of attendance. And anything that has to do with job search or with like postgraduate education applications, we're not allowed to factor that in financial aid as part of the cost of attendance. So that's why the Student Success Fund exists. And that's, I don't know very much about exactly how that's accessed, but I know that we can get you to the right place, that students, if they don't already have that information, we can help them find how they connect with the people who help with that.
Great, thank you. Okay, and then we just had a parent ask about a cover letter. Their student was talking to them about a cover letter for their application, and they were curious how that's different from a committee letter.
So a committee letter traditionally implies a ranking and evaluation, and we don't rank our students. We help everyone, advocate for everyone. So we write a letter of introduction and advocacy. That's our cover letter. And it emphasizes, their strengths, especially will highlight things that are in common across faculty letters that, are submitted on the student's behalf. So, if everybody talks about a particular, characteristic or attribute of the student that is being recommended, we'll highlight that as well. But we also just, help them tell their story the way they want it to be told. So that's one of the reasons we have such an extensive preparation, and why you have to meet with your pre-health advisor and do a bunch of homework that you submit before the meeting, is that that's a chance for you to rehearse and refine your narrative, but it's also a chance for you to teach us your narrative so that we can do a good job in writing that letter of introduction. So that is how our cover letter is different. We really believe that there's no way to rank our students anyway. We think that is silliness because Mizzou, which is a great medical school, is looking for something different than Harvard is. And the student who is most strongly recruited at Harvard may be of no interest to Mizzou, because Mizzou would love a kid from rural Missouri who wants to go back home to rural Missouri and practice. That's really their mission, and that student might not be a top pick at Harvard, but that doesn't mean that they're not at the top of somebody's list. So there is no ranking because there is nothing universal. And that's why we really emphasize fit and match in selecting school list.
Great. Thank you so much, Carolyn. So I'm going to ask one last question for the evening. And that question is kind of a big one, but what do you want parents and families, and I know we had some students on here, to take away from this webinar about pre-health advising? If there were like a few things you really want to make sure they take away.
Everybody on my team wants to support students and be their sort of advocates and partners in figuring out how they can be successful. So no matter what, if students are stressed about, they feel like they've made a mistake, they feel like there's a lot of social comparison around here. I will just, I'll be honest about that. I don't think it's a cutthroat or competitive place, but I do think there's a lot of social comparison. And that's like, I guess, everywhere, with social media being, part of the problem. But if students, feel like, oh, I'm not doing enough, I'm not doing as much as my suite mate, or I'm not, whatever, in whatever bucket they feel like they, are feeling insecure about it, they should come to their pre-health advisor. We will help them strategize, but also possibly just calm them down and reassure them that they are enough just as they are.
Awesome. Thank you so much. Thank you again, Carolyn, for all that information. Families and students, we hope you learned valuable info tonight. I know we did not get to all of the questions, and some were very specific to certain scenarios. So we're going to go ahead and put Carolyn's contact information in the chat. And you can also always direct those questions to Student Transitions and Family Programs at transitions@wustl.edu. And we'll then reach out to Carolyn, get you an answer, and get that answer back to you. So as a reminder, this webinar recording will be shared at families.wustl.edu next week. Stay tuned for our next webinar, which is a conversation about student engagement and leadership, which will be in a little over a month, Monday, April 8th at 5:30 p.m. Central Time. And you can register for that webinar at families.wustl.edu. I hope to see you all then. And thank you again, Carolyn. I hope everyone has a good night. Bye.